Nel trattamento di pazienti con problemi osteoarticolari emerge sempre di più l'importanza del corretto trattamento del giusto paziente. Di questo se ne è parlato anche durante la terza edizione del Simposio internazionale sul trattamento intraarticolare in corso a Budapest, e noi abbiamo cercato di capire meglio l'argomento e addentrarci insieme al dottor Raghu Raman del Dipartimento di Ortopedia dell'ospedale di Cottingham in UK. Dr. Raman, you have a presentation today on predictive factor of viscosupplementation for knee osteoarthritis.
That's correct, yes.
Yes, correct. Okay. Why do we need the best responder?
It's very important to identify the right patient so that we can tailor the right treatment to the right patient. Viscosupplementation or intra-articular hyaluronic acid works best if we identify the right patient to get the best outcome or the maximized results. There is a 20% failure rate when intra-articular hyaluronic acid is given, and so if you identify the best responder, you can increase the response rate from 80% to about 90 to 95%, and that is the reason we need to identify who's the best responder to give this treatment.
You have talked about also on the best responder criteria. What are the best responder criteria?
The best responder criteria is again based on clinical and radiological and mechanical and biological criteria. From a clinical point of view, patients aged between 40 and 65 with early stage disease, preferably males, as they respond better than women, and also treatment along with other modalities of treatment, so part of a multimodal treatment. All of this will ensure that the patient has the best outcome from intra-articular hyaluronic acid.
In your presentation you have talked about on some examples, some literature examples on predictive factor of good response. Could you tell us some of these examples?
If you look at some of the meta-analysis study that was done, the predictive factors that were identified on the meta-analysis was first age and second early stage disease. If you look at some randomized control studies that was done, another thing that was identified was patients who are not overweight, i.e. BMI of less than 25, and in some newer studies where biomarkers are being researched as predictors of good response, again we find that early stage disease performs better than late stage disease.
And to conclude about your opinions, viscosupplementation works?
Yes, viscosupplementation works as a class. There is a lot of difference between different types of viscosupplementation, but as shown by the Cochrane review and all the other big meta-analysis, viscosupplementation works as a class as a part of a multimodal treatment in management of early osteoarthritis of the knee.